Hello, my name is Chadian Dumele. I'm a cardiologist, and today I'm really happy to be here talking with a group of wonderful individuals about their experience with taking GLP-1 receptor agonist therapies. Would you like to introduce yourselves?
Absolutely. My name is Kate Stewart-Gary.
I'm Beth Green.
I'm Jennifer Ross.
Well, thank you all so much for being here today. These therapies are obviously on everybody's mind, so we're really excited to hear your perspective as individuals who have been taking these therapies. So why don't we just start with a simple question of, which may be not so simple, your journey to getting started on these therapies, because everybody's journey is probably a little bit different. So why don't we start with you?
Absolutely. So I had done okay most of my life managing my weight, and then I had a baby. And as much of a blessing as he has been on my life, it has been really hard to lose the weight postpartum, and the numbers on the scale just kept climbing up. And when that happened, I spoke to my primary care physician, and he also noted that my cholesterol levels were rising. The weight just would not come off. So I ultimately found a weight loss specialist who could work in tandem with my primary care provider.
Thank you so much for sharing that. Beth, can we hear a little bit more about your journey?
I've had a family history of diabetes and basically had a very high A1C, and I said last year, I'm ready.
Jennifer, how about yourself?
So once I went into menopause, I started gaining weight. Nothing worked. Nothing that I used to do, which was eat right, exercise, everything. Nothing was working. So I went to a medical group that specialized in menopausal women and talked to them about what I could do. They suggested that I use this type of therapy. I've been on it for almost a year. I've lost 30 pounds so far, and I feel so much better. I feel like myself again.
These medications are obviously having a tremendous impact. I'm so happy that you've all found them. So there's the prescribing, that's kind of step one, but then there's the actual getting of the medication. So how has that journey been for you all?
Actually, it hasn't been too bad. My pharmacy has been really on top of everything, and
Good.
I've been able to stay regular with my prescription.
So Jennifer, let's talk about your experience with getting from the prescription to actually getting the medication. What has that journey been like for you?
So it was a challenge at first. My health insurance decided that I did not qualify because I was what they considered pre-diabetic. My A1C didn't meet that number. I had to start coming out of pocket. So my cost is $300 to $350 every 6 weeks.
Wow.
Quite a cost.
Wow. And that's obviously not something everybody can bear, but
Correct.
I'm happy you're still been able to continue, but that's a real challenge.
Absolutely it is.
A lot of the times with these therapies, the people who get coverage the most are individuals who have existing disease, who have heart disease or who have diabetes that's kind of full-blown already. And there's a little bit more of a struggle for people to get on the therapies to try to prevent some of the bad things from happening. What's your perspective on that?
I know I have been so fortunate to get coverage, and it's still so frustrating that so many people can't get it. So many people always ask, why can't medicine be more preventive? And I think the problem is people interpret that as to mean lifestyle only, as preventive. That preventive means not taking medications. But as we can see with GLP-1s, they're preventive medicine on their own.
As I mentioned earlier, I do have cardiac disease, borderline diabetes, or it's diabetes. I do have had an elevated A1C, and I was very fortunate. I was approved in 2 days, insurance covering everything, and it is unfortunate that there are so many people in this country that could use it.
It is very frustrating. I would think that we would want to prevent some of those diseases, and you know that this type of therapy can help you and prevent heart issues or diabetes or something, that people should have access to it and that it shouldn't cost that much money to take care of yourself.
Well, let's talk about your symptom experience after starting the medication. So what did you notice that changed after starting these therapies?
So I definitely noticed that the food noise is mostly gone. It's made eating intuitively just an easier process, because in the past, I found it difficult to just stop when I was full if my body wasn't producing those correct signals. And I also noticed I started sleeping better. At the same time, there have been some side effects. I have had some nausea, but I'm able to manage that with some other medication, as well as staying on top of hydration and staying on top of eating when I'm hungry, and finding that helps with the nausea quite a bit.
Thank you for that, Kate. So Beth, what about the good and the bad in your experience?
Every once in a blue moon, a few hours after I've taken the medication, I will get nauseous, so I'll have some crackers or pretzels, and it seems to just go away, and that's really it. And as for cravings and wanting to eat, it has subsided. My weight loss journey, just shy of a year, is just about 18, 19 pounds. So
That's remarkable.
I'm pretty happy, and I feel good. I think I'm more excited about lowering an A1C.
Hopefully you've been talking about this with your weight loss professionals, but this is all about physiology.
Yeah.
It is literally all about physiology. Everything in your body actually works against all of the lifestyle changes that you've been making for so many years, and just basically makes them all harder to stick, makes it harder to maintain. These therapies are one of the first class of therapies that actually work with you and stay with you throughout that journey.
I feel like this has been a partner for me. I eat healthy, the cravings have stopped, and I can turn off as far as not eating right and eating right without any problem.
You know, what all of you are describing seems to take a good amount of trust in your medical partners, in the healthcare system, but not everybody has that trust. What do you think how important has that been to your journey?
My partnership with my healthcare professional was key, that they believed me and they said, you're not crazy. This is happening to you. You are trying. It's obvious that you've been trying to lose the weight. So the fact that I was validated and that we have worked together on this journey has made all the difference.
The weight loss levels are substantial. There's a lot of people who are asking the question, is it lifestyle or is it these therapies? But I think that's the wrong question. So Kate, let's hear your perspective on the importance of having support both for lifestyle as well as for these therapies in tandem.
I feel like I couldn't do one without the other. For years, I tried lifestyle alone and it wasn't working. And at the same time, I know that the lifestyle changes and the supportive changes are going to be so crucial to maintaining and even building my health long term. One of the best things that my weight loss practice does is it pairs the medication with dietary and exercise changes, and it's been so much more motivating to do them both together.
Same. I feel like it helped, it accompanied my behavior. I have increased in working with weights, and I've increased in being mindful of protein in my diet, and worked in partnership with the therapy.
We've talked a little bit about the idea that there's a lot of weight stigma out there. What are your thoughts about ways, either in your life or we need to do as a society, to combat this stigma, either in medical settings or in real world settings, on social media and online?
There is so much stigma around weight and how it is viewed as a function of character rather than your earlier point about it being a function of physiology, because we have this idea that we can make ourselves healthy with just some effort.
With the stigma, I know that I've had friends that have had concern, and I've told them, listen, I'm working with a healthcare professional. This is not random. I've done the research.
So given the stigma that's out there, it's not always easy to come forth and say, hey, I'm taking these therapies, even though there's something that lots of people want and lots of people are interested in. So what made you decide to be here today to discuss your experience with taking these medications publicly?
Honestly, there are other areas of my life where I have to deal with stigma and prejudice and other issues, and I find the best way to combat that is to show my face and to show that courage and to show other people they're not alone.
And I need to be healthy, and that's what I'm on this for. It's really important to do what you have to do for yourself and not what everybody else is doing.
I'm so grateful that there's something out there to make me feel better, because I was scared. I didn't know why I was feeling the way that I was and that I couldn't lose the weight, that I'm just absolutely happy and grateful that I can share the information.
I'm just so happy, first of all, that all of you have had such great experiences with these therapies, and also that you're willing to share this journey with us. So on behalf of everybody watching, thank you. Thank you so much.